Microscopic polyangiitis is a vasculitis, or inflammatory disease involving blood vessels that affects the kidneys, lungs, and skin. In this scene, I'll give you my visual mnemonic to help you remember the specific pathophysiology, symptoms, and treatment of microscopic polyangiitis, so you'll be ready for test day. Get ready! We're going to be diving into the set of Will Smith's I Am Legend, or maybe just taking a trip to zombie land. Let's go! First, let's take a look at your microscope here. Coincidentally, this microscope makes me think of microscopic polyangiitis. You know, microscope for microscopic. Not only is this microscope here to help you remember microscopic polyangiitis, but it's also here to help set the scene for Pixarize's version of I Am Legend. Imagine this. A radioactive asteroid just hit the Earth, and fumes from this asteroid are transforming people into zombies. Our main character, and I'm referring to you here, have also been affected with this toxic zombie fumes, and you're trying to research a cure before all of humanity is destroyed. That's why you're on the microscope inside the laboratory, furiously searching for a cure. How's that for a thriller? Next, shift your focus to the crowd of zombies outside the window. Looks like one of the zombies is standing inside a small puddle. By the way, this small puddle is here to help you remember that microscopic polyangiitis is a small vessel vasculitis. Because we use bodies of water to show vessel size, this small puddle is our recurring symbol for small vessel. Get it? As if the word microscopic wasn't enough to get you to small vessels. Microscopic vessels? No, small vessels. Anyway, the small vessel inflammation is what is responsible for the signs and symptoms seen in microscopic polyangiitis. Next, notice how our zombie is splashing around in the puddle. Yep, he's getting himself all wet with water droplets as he wades through the puddle. These small water droplets spraying over the zombie are here to help you remember the finding of palpable purpura. Yeah, involvement of small vessels near the surface of the skin leads to palpable purpura. Now, what are palpable purpura, you ask? Well, palpable purpura are visible, non-blanching hemorrhages that occur in the skin. They look a bit like water droplets. Well, if water droplets were purple. These purpura are also palpable because they can actually be felt by palpating the affected area. They look a little like this. Palpable purpura is seen in nearly every small vessel vasculitis, and it happens because involvement of small blood vessels under the surface of the skin. You see, inflammation of these small vessels causes leakage of blood, so the purple color and raised appearance is really just blood collecting under the skin. Next, shift your attention back inside the lab. Check out that bloody urine sample you're analyzing under the microscope. Gross. I sure hope you're wearing gloves while you're examining this specimen. This bloody urine sample is here to remind you that microscopic polyangiitis causes hematuria, or blood in the urine. This is caused by kidney damage, but we'll go into the pathophysiology of this later on in this video. Now, take a look at this bloody handkerchief in the corner over here. Yeah, I've been coughing up blood all morning, as if having hematuria wasn't serious enough. This zombification process really doesn't mess around. Anyway, the blood on this handkerchief should help you remember that microscopic polyangiitis causes hemoptysis, or coughing up of blood from the lungs. Hemoptysis is really important to remember because it should help you clue you in to lower respiratory tract involvement rather than upper respiratory tract involvement. Just remember that if a condition causes hemoptysis, it most likely involves the lower respiratory tract. Easy peasy, right? You might be wondering why our zombie is splashing around through the water in the first place. Well, if you take a look at his right hand, he's busy trying to cause as much chaos as possible. And what better way than to smash all the lights in the area? Maybe because zombies are damaged by light, or am I thinking of vampires? Either way, notice what our zombie is using to smash the streetlight. That's right, it's a crescent-shaped sickle. This crescent here should help you remember that microscopic polyangiitis causes a crescentic glomerulonephritis, otherwise known as rapidly progressive glomerulonephritis. The crescentic in crescentic glomerulonephritis refers to characteristic glomerular crescents which can be seen on renal biopsy. The crescents themselves are really crescent-shaped scars, which are of course indicative of glomerular damage. But there's more. Let's return to our broken lamppost. Since it's smashed, you might even say that there's a lack or paucity of light here, or really just a lack of fluorescence. The lack of fluorescence here should help you remember that a pauci-immune pattern is seen on immunofluorescence. Pauci-immune meaning no immunofluorescence, as in nothing lights up. Yep, this street light is definitely not lighting up anything. Let me break down why this matters. Crescentic glomerulonephritis is not unique to microscopic polyangiitis and actually has a variety of causes. To narrow down the differential diagnosis, we need to run immunofluorescence on the biopsy slide. In this test, immunofluorescent probes are attached to antibodies specific for IgG. Since IgG is a type of antibody, the presence of immunofluorescence indicates the presence of hypersensitivity. While other patterns exist, one characteristic of microscopic polyangiitis is a completely negative pattern, also known as a pauci-immune pattern. The word pauci means few, so a pauci-immune pattern refers to a lack of bound immunoglobulins and deposited immune complexes. Now let's return to our image. This broken light is here to help you remember no immunofluorescence, which constitutes minimal evidence of hypersensitivity. The glomeruli are being damaged, but the damaged glomeruli have no IgG. The glomeruli are therefore being damaged in some other manner. Next, notice the zombie who's riding a moped. It looks like she's desperately searching for a cure on her moped. This moped should help you remember that microscopic polyangiitis is positive for MPO-ANCA. Moped for MPO. Get it? Remember how we just talked about how a pauci-immune pattern helps narrow down the differential diagnosis? Well, turns out there's actually 3 systemic vasculitides that have a negative or pauci-immune immunofluorescence pattern. So in order to distinguish between these 3 systemic vasculitides, we can order tests for anti-neutrophil cytoplasmic antibodies, also known as ANCAs. ANCAs refer to autoantibodies against proteins found in neutrophils, and a specific protein targeted is myeloperoxidase, or MPO. Microscopic polyangiitis is notably positive for MPO-ANCA, which means that we can expect to see antibodies against myeloperoxidase. On a related note, take a look at the zombie's pearl anklet. Riding a moped really highlights your ankles, right? This zombie has some fresh style inherited from her human days. If you have any doubts about this, just check out that pearl anklet. This pearl anklet should help you remember P-ANCA, which is just another name for MPO-ANCA. Get it? Pearl begins with a P, and anklet sounds like ANCA, so pearl anklet should remind you of P-ANCA. The P in P-ANCA actually stands for perinuclear, as myeloperoxidase, or MPO, is usually found around the segmented nuclei of neutrophils. Here's a picture of how this assay looks when positive. I just like to remember P-ANCA as pearl anklet. Got that? Let's move on. Next, take a look at the zombie over here in the right corner of our image. This zombie is here to help you remember that microscopic polyangiitis also results in necrotizing vasculitis. In other words, necrotic or dead areas are seen in and around blood vessels. What better way to symbolize necrotizing vasculitis than with necrotizing, rotting zombies? Necrotizing vasculitis can be a symptom of several small vessel vasculitides, but our earlier conversation on immunofluorescence patterns and ANCA assays should help you get to the right diagnosis. Finally, notice how the zombie is one-eyed. Yep, he's a Cyclops zombie because the asteroid fumes hit him real hard. By the way, Cyclops also helps me remember the drug cyclophosphamide. Get it? Cyclops for cyclophosphamide? Our Cyclops here should help you remember that one of the treatments for microscopic polyangiitis is cyclophosphamide. Cyclophosphamide is a potent immunosuppressive agent and is used to treat a wide variety of vasculitides. Just remember our Cyclops here to remember that we can also use cyclophosphamide to treat microscopic polyangiitis. Cyclophosphamide isn't our only treatment for this condition. Take a look at this asteroid, the extraterrestrial object that started this whole crisis in the first place. The asteroid is actually another source of treatment for microscopic polyangiitis. And what could it possibly represent? You got it, corticosteroids, because asteroid rhymes with corticosteroid. This asteroid is just here to help you remember that corticosteroids are an alternative treatment for microscopic polyangiitis. Boy, am I tired from researching zombie skin, lung, and kidney infections. Let's do a quick recap. Microscopic polyangiitis is a small vessel vasculitis that affects the skin, lungs, and kidneys. Blood vessel inflammation under the skin causes the development of palpable purpura. Involvement of the lungs can lead to hemoptysis, and involvement of the kidney leads to hematuria. On renal biopsy, a rapidly progressive or crescentic glomerulonephritis is seen, and immunofluorescence reveals a posse-immune or negative pattern. Importantly, patients with microscopic polyangiitis will often test positive for MPO-ANCA or P-ANCA. Treatments for microscopic polyangiitis include cyclophosphamide and corticosteroids. Well, that wraps up this video on microscopic polyangiitis. I hope I find the cure before I turn into a zombie myself. On to the next one.